Hello. Thank you for joining us for this special live session of Science News Now on what it's like for journalists to cover the biggest story of our lives, the coronavirus pandemic. We'll be talking about the challenges of covering this huge story while also living through it. And we'll be answering audience questions. So please ask them in the Q&A chat section. I'm thrilled to introduce you to the 6 amazing Science News journalists who have led our coverage of the pandemic. I'll let them introduce themselves. Amy, let's start with you.
Hi, I'm Amy Cunningham. I cover health and biomedicine. I've written about kids in COVID and COVID vaccines, among other stories. And this past year, I just finished a large project that takes a historical look at infectious diseases and epidemics over the past century.
I'm Erin Garcia de Jesus. I am a staff writer here, and I have mainly been covering viral variants. I have a background in evolutionary virology, so I've been writing a lot about the virus's evolution as well as vaccines and how variants and vaccines are interacting.
I'm John Lambert. I'm also a staff writer here at Science News, and I focus more on the public health side of the pandemic. So early on, that was covering a lot about testing and contact tracing. And these days, I've been focused a lot on vaccine equity, both in the U.S. and abroad.
Hi, I'm Laura Sanders, the neuroscience reporter at Science News. I've been focusing on the brain and how the virus might or might not affect the brain directly, and how stress from the pandemic has interfered with all sorts of things. I've also covered how shutdowns and school closures affected kids, both mental health and academic performance.
Hi, I'm Sujata Gupta. I'm the social sciences writer, and I've covered a range of things involving people's psychology and mental health, behavior, risk perception, along with disparities, social and educational level disparities.
Hi, I'm Tina Hessman-Say. I'm one of the senior writers here at Science News. My beat is molecular biology, but the past 2 years I've been covering mainly many aspects of COVID, including drug treatments, vaccines, how the virus affects the body, and lots of other little things like that.
Thank you all. Let's start with Erin and talking about the big news of this week. You just reported on the new Omicron variant in our coronavirus update newsletter and also for our website. And what it's been like covering the emergence of these new variants, especially when at the beginning there's almost no information available?
I mean, in short, it has been much like the rest of this pandemic, which is to say it is a roller coaster. Specifically with Omicron, I think many of the unknowns are very much still unknowns. For instance, when I was reporting on things like the Alpha variant that first emerged in the United Kingdom at the end of last year, or the Beta variant, there was some indication already in the community of increased transmissibility. There is some indication that Omicron may be more transmissible, but a lot of that data is very, very early. So I would say the unknowns are even greater in this case. So we're navigating this very hard to navigate time, and it's very hard to report on things that we don't have answers for, because people want answers. I want to know all the answers to these questions. Our readers want to know. The scientists themselves want to know, but we just don't have the data yet. So trying to take a step back, thinking about why we don't have answers yet, what will it take to get answers, has been an interesting experience and difficult, I would say.
Really difficult. That uncertainty and frustration and just not knowing feels a lot like it did way back in January 2020 at the very beginning of the pandemic. There was just so much we didn't know. John, you wrote our very first story on the novel coronavirus in early January. What were you thinking about that then?
Yeah, that week, so I think I published the story on January 10th, and that week my head was not in the world of virology. I was working on this story about ocean acidification and whether it was affecting fish behavior. And we get this WHO report that there's this outbreak of a mysterious pneumonia-like illness in Wuhan. And I was assigned it not out of any particular expertise in virology or epidemics. And I remember just trying to call up a few sources and try to get a handle on what this was and what it meant. And going back reading the story now is kind of surreal. I have it up here, and I just want to read the first two sentences because I think it's kind of crazy to think how little we knew. But on January 10th in 2020, I wrote, a mysterious outbreak of pneumonia in central China has preliminarily been pegged to a new coronavirus, but the World Health Organization says there's no need to panic. Chinese officials have reported little evidence so far of human-to-human transmission, the WHO says, making an epidemic less likely, which in hindsight seems kind of crazy that was our take back in early January. But so to sum up, I wasn't really thinking that it would explode into what it has when I first started reporting on it back then.
Was there one piece of evidence or thing you heard that made you realize, oh gosh, this could be really bad?
Yeah, I think as sort of the weeks progressed and the sources I was talking to went from being sort of very careful not to overstate the risk to being a little more sort of audibly worried, my general sense of worry sort of crept up. And then there was actually a study that Tina flagged about a German business meeting where it became clear that people could spread the virus before symptoms. So Tina was the person who made me think, oh gosh, this is something we will probably be having to deal with for quite a while.
Right. Yeah, that study out of Germany was at this German auto parts company where they really jumped on things, and that outbreak at that company told us so many things about the virus. That was like the thing for me that really made it seem like a big deal and that this thing was going to go crazy, because they did find evidence of transmission before people had symptoms. And in a follow-up to that initial paper, they actually tracked the people and they isolated infectious virus from them. And they found that even people who never developed symptoms could transmit the virus, or at least they were making infectious viruses. And then a little later, at the beginning of April, the National Academies of Sciences released a report saying that the coronavirus is airborne, that it could be transmitted in aerosol droplets that you spew out just sitting there breathing or quietly talking, and then you make many more after that. So those two things together were like, oh wow, this could be bad.
Yeah. Oh wow, indeed. And Laura, you were actually at a scientific meeting with thousands of other scientists. What was that like?
Yeah, I mean, looking back, I would never have guessed what would have happened next. But it was very much a moment that I'll never forget. I was in a session on the coronavirus, 8 a.m. on Valentine's Day, with my editor, Macon Morehouse, and we were listening to Trevor Bedford at the Hutch and a scientist from Gates Foundation talk about how much we don't know about the virus and how our estimates at the time were likely to be vast underestimates of how many people had already been infected, even back in February. And so, yeah, just that feeling of sitting in a room with a lot of other people inside in a big conference, And there was a sense of kind of anxiety and a fear, really. It was the first time that it really hit home with what we're facing, what we're looking at. So yeah, that's a moment I won't forget from this pandemic.
Yeah, and it's not often when we're sitting covering a scientific meeting where the dominant emotion is fear, that's for sure. We have an audience question. How do you handle stories where the information you're learning today means that a story that was written only a few months ago is now inaccurate? I think that one that we saw a lot of with this because especially in the early months, there was so much science coming out so fast and things were changing so fast. So who wants to talk about how we as journalists answer that?
Well, I think we try to acknowledge what the state of the knowledge was before and what the scientists have now done in order to figure out what is really the case, or at least what is our best understanding now. You know, communicating that uncertainty is really important, and it's a very difficult job. I think we need to let people in on what exactly the scientific process is, that it builds on itself, it corrects itself, and you know, just because the state of the knowledge changes doesn't mean that, you know, that means we have to throw out everything and can't trust anything. Over time, you get a more concrete understanding of the thing, and once you build up a certain level of evidence, you can be pretty confident in the answer. But, you know, sometimes mistakes are made, and, you know, I remember at the very beginning, before we knew that this was an airborne virus, people thought that it was transmitted mainly by droplets that you would spew out and then, you know, touch a surface and touch your face and then get infected that way. And they were saying, don't wear masks. And so one of my husband's co-workers, his wife called me and was like, you know, I bought masks and now people are saying we shouldn't wear masks, but they're saying we need them for the hospital workers. But if they protect the hospital workers, why won't they protect me? And I thought, you know what, that's a really good question. And I don't know what to tell you. And you know, I still regret from the very beginning saying that, you know, ordinary people shouldn't wear masks, because it's very clear that masks work and are one layer of protection against the virus. And you just have to own any mistakes and, like I said, you know, acknowledge what the state of the knowledge was before and try to move on.
Thanks, Tina. Yeah, it's so, again, this has been such a difficult subject for us to cover in so many ways. Actually, here's another audience question that is a good one for us. This listener says he's a print journalist and he's very impressed with the academic credentials of the journalists who write for Science News, since many of you have PhDs and other advanced degrees. And how does that academic knowledge change how you approach your assignments?
I mean, I think for me, it doesn't always affect how I approach assignments. I do sometimes have to kind of remove myself from what I know just on a regular basis to think about what our readers need to know, because my background is in virology and my background is in immunology, and I write a lot about both of those topics. And so sometimes I have to remember that something that isn't, you know, that is buried in my brain that I know as something that I think lots of people will know, you know, like T cells are important. Not everybody knows what a T cell is. You know, these are cells that are in our body that are on the hunt for pathogens that are going to protect us, and they're really important for protecting us from disease. And so taking a step back and thinking about what information is 100% relevant to what story I'm writing, and what questions are our readers going to have is really important.
Thank you, Erin. That's really helpful, especially for people like me who do not have PhDs in virology. So I want to ask Amy a question, especially since she covered a lot of how COVID has impacted children, including how they get sick with COVID, what might happen, and also how it's affected schools and learning. And how is that reporting on that shaped your perception of how this is affecting people?
Yeah, so, going back to what Tina was saying, our understanding of this virus continues to change over the course of the pandemic. And as a reporter, we're taking in all that information and we're continually trying to make a bigger picture. But often the public just gets snapshots. And I think it's been, it can be difficult to dislodge early impressions that people get, before more data has come in and before we have gotten to get that bigger picture. And this has been really true with kids and COVID. So, early on, there were fewer cases for kids compared with adults, and it wasn't clear if kids could really spread COVID. And that's in contrast to, we know kids are really good spreaders of influenza. But that was a time when kids weren't in school, and that was a time when kids weren't in the community like they normally are. So there's a lot of nuance there, and there's a lot more we had to learn. But I think early on, this idea got stuck in people's heads that, oh, kids aren't affected by this. And that's a comforting thing. It's understandable why people heard that and like, okay, good, we're set with that. But, we found that wasn't the case. As kids got back to school, as kids got back to their activities, to their sports, as they were out and about, especially as the Delta variant hit, cases in kids went up, and with that came more hospitalizations, and with that came more deaths. And we have, learned about a really severe immune response that kids can have weeks after infection. We've learned kids can have long COVID. So I think it's really challenging as a reporter, all this information coming in, and you're trying to create this bigger picture that captures the nuance and tries to help people understand, this is what we understood in the beginning, but this is where things are now. And that's, for many things about this pandemic, that has been a challenge to get out.
Thank you, Amy. We have a listener who wants to know about what process we use to verify stories before we print them, and also, what we use as resources. And that's actually something we've talked a lot about with this, because we ended up using a lot of sources that we typically don't rely on. We're pretty much obsessed with accuracy here at Science News, and we fact check. We have professional fact checkers. We do a lot of verification and are very careful about our sources. But this upended our processes in a lot of ways. Tina, you had some thoughts on that. Do you want to weigh in?
Yeah, definitely. I've been reporting a lot on vaccines and drugs, and a lot of the first information about those comes from press releases from the companies that are making them. And so you have very little data to go on. You have only the numbers that they give you, and they don't tell you much at all. Sometimes they don't even tell you exactly how many people were in the trial, for instance. So you have to report that. You put a link to the source, and then you talk to other experts and try to see, does this sound reasonable? What are the caveats here? And that's also been true for preprints. So, prior to this, we rarely would report on preprints, which are papers that are posted to these internet servers for anybody to look at and comment on that have not been through the peer review process that is normal before papers appear in scientific journals, where other experts in the field have combed through the data and seen whether this is a reasonable thing. Peer review is lots of papers that get retracted even after they've gone through peer review, but at least it's one layer of vetting of a scientific study that you don't have when it's a preprint. So you have to be really diligent about going and getting outside comment and getting people who really do know what's going on in that field to take a look at it and try to help you out, tell you where there's shortcomings and things like that. Yeah, we do a lot of fact checking, trying to find independent sources to verify these things. It's really not easy, especially when there's so much information coming out and so much of it being contradictory. You don't really know exactly what is right at the beginning. And like I said earlier, sometimes it's maybe better to wait a little while to try and figure out what's really true and what's not by the weight of the evidence that's coming in.
Yeah, I just wanted to add something to that, is that Tina, mentioned that we're relying a lot on preprints, which we are, but we also have to remember that sometimes even peer-reviewed papers, we really need to get a lot of perspective on those as well, because peer review is not perfect. And so talking to a lot of scientists or talking to a lot of experts in that field to get a sense of even peer-reviewed papers is really important. Because I remember the first coronavirus story that I wrote was, a few weeks after John wrote his, and it was a peer-reviewed paper that said that the origin of the coronavirus was in snakes. And all the virologists that I knew were like, this is ridiculous, no. And I knew as a virologist that it was probably also not true. So I talked to a few experts and who told me the analysis that was in this paper is not appropriate for the type of conclusions that they're trying to come to. So I'm taking this with a very, with a grain of salt. This is probably not the case. And it definitely was not the case. It was an interesting experience. And I mean, that being my first story was, taking down a peer-reviewed paper was interesting.
Yeah, if I can add too, I think Science News has provided a good resource in this media environment where often headlines will sort of grab something really catchy from an individual study, but when you delve into the details of that study, it doesn't really support the headline that's getting sort of blasted across a lot of large outlets. One example that I remember was in August of 2020 or sometime around then. There was a study that caused headlines to say that neck gaiters were worse than wearing no mask at all because they sheared the droplets as they were coming out of your mouth. And a lot of people wear neck gaiters as masks. And so I looked into the details of that paper, and it was in no way designed to answer that question. And I think that we provided a good kind of check on this story that had gotten, or this paper that had gotten sort of undue coverage by just delving into the details of that paper and saying what they can and can't say.
Yeah, I particularly appreciated your work on that, John, because it's painstaking reporting, and it's also tough to come back when all these other news outlets are saying, oh yeah, neck gaiters are bad, and say, well, no, actually, what the study says is this, and make sure that people get the accurate information. We have a number of listeners who are curious about COVID in the brain, and I'd love to hear from Laura Sujata, because you have put a great deal of work looking at, COVID's effects on the brain, on mental health, and also on how people behave Laura, do you want to start out?
Yeah, sure. It's been fascinating, and like all these other aspects of the pandemic, the science has been really unsettled, and there are still a lot more questions than answers. The kind of best evidence so far suggests that the coronavirus doesn't infect brain cells directly, but it's more kind of these systemic effects of being severely ill. But one thing that's definitely clear is the stress and worry and anxiety that this has all caused has huge effects. And it's been interesting because that's not a new area of neuroscience. You know, for a long time, people have known that severe, long, unpredictable stress can really do a number on all sorts of things, our thinking abilities, our sleep, our mental health. So we've been kind of following along and trying to put what we're all experiencing into this context of this research that we know. So it's been interesting thinking about, you know, the features of the pandemic, such as we're all isolated at home, we're all wondering what's going to happen next. It feels like a roller coaster, as Erin said, and you know, added burdens of homeschooling children or extra job duties. It's all kind of this perfect storm of, if you were to design a system to create kind of damaging stress responses, this would be it. So, I mean, that's the pessimistic answer. I think Sujata might have a more optimistic, you know, what can we do about it? How do we go from here?
Well, I'll start with pessimism, but maybe I can end with optimism. So I remember when I was first studying sort of the mental health fallout of the pandemic, there had been, you know, books written on how we would handle pandemics, and there was this expectation that people would behave in a certain way. Basically, they would follow whatever advice is given. But the advice was, as Tina said, kind of contradictory, like around masks, and then also just people didn't behave in ways that people had predicted. And so covering behavior has been a very interesting journey through this whole thing. I just remember early on I covered, I spoke to a scientist who talks about risk perception a lot, and she just had this excellent point that we know that people who feel more angry are going to flout the rules more, I think, and people who feel more fearful are going to sort of hunker down more. And that turned out to be so prescient, I think, in the end. And I think personally I was getting a little down, like we were getting overall, I would say we've gotten the science of our understanding of this virus pretty solid. Like, we kind of know how it operates, and we keep trying to keep up with all these variants, but we haven't really done a good job on the softer sciences, I guess, on the behavior and the decision making and the risk analysis. Like, that's been a lot muddier. And so at some point, I think I just took a turn to psychology. I'm like, what can psychology say about how we can handle all this noise? And I sort of, it was a strange route. Like, I was like, well, I don't remember how it happened. So I was reading about aerosols for some reason, and he had these sort of two ideas, like people pursue a good life through happiness, and these are lay terms, or through meaning. And I knew that people weren't really happy. And then I'd also read a paper that said that we get meaning sort of through our routines, and those were really disrupted. And I'm like, oh, great, so we're just not going to have a good life. And then I came across a body of work that really just spoke to me, and it was like novel experiences alone, not adding up to anything greater, just doing new things could maybe help us sort of survive this moment. And so I started applying these things to my own personal life. I took up pottery, which I write about in one of my stories, and I started walking regularly with a friend. Initially, it felt so stupid. We'd go to the same place on the same day, and we'd go on the same exact walk. And like months into this, I'm like, wow, this is really an anchor point in my life. So yeah, I don't know. For me, that was like a more optimistic turn, that like we can do these things that can make our lives a little bit better. They're small. They may not be like sustainable for like a good life for the long haul, but hopefully this is not going to last forever. So that's kind of where I came away with that.
And Laura and Sujata, you had a really interesting conversation as part of our session that was recorded on stress in the brain and the pandemic, where you talked to both a neuroscientist and also a psychiatrist who works with a lot of populations in different countries, people who have been in very stressful, traumatic situations. And I loved looking at that both in terms of brain and society and how we're so a part of our communities and that communities can actually help us through these horrible times. What did you learn from that conversation?
Yeah, I mean, it gets to this idea of we're social creatures. We derive so much of our meaning and our health and our success and happiness from those around us and being a part of a community. So there have been really well-known effects of isolation, you know, in human beings and in animal studies. We're not meant to be alone. We need stimulation. We need other people around us. And so I think that discussion and that framework of us as a part of a larger system is really helpful and interesting, both in terms of kind of how things go wrong, but also how we can use it to buoy ourselves, to support each other, and to heal a little bit.
Yeah,
and
just to add to that, oops, sorry.
No, go ahead.
I was just going to say that I found Brandon Court was the researcher I spoke with, and I had read a popular science article where he talked about PTSD, and his research really showed that we tend to treat PTSD or post-traumatic stress disorder as a sort of individual problem, manageable with sort of wellness programs or yoga or mindfulness, which not to knock any of that, but his research really showed that it's a societal problem, that when people returning from war have a societal support group, they actually fare a lot better than if they're left on their own with all their sort of wellness programs. And I thought that was really eye-opening and just really spoke to how intentional we need to be in this moment where it's easy to be super distant, that we need to continue to cultivate our communities or build new communities and actively seek out community as one of the most important things for our overall well-being.
It's so true. And I also loved how your researchers talked about empathy as being incredibly powerful, not just receiving empathy, which you said, yeah, that'll make me feel better, but also having empathy for other people as making yourself feel better too. One thing that I think has been hard for us all, everyone around the world, but also for us as journalists, is being stuck at home, working from our houses and apartments. And as journalists, we love to be out in the world and reporting on what's happening. And John, you had the opportunity to do some field reporting this summer on getting vaccines out to underserved communities. What was that experience like after being at home for so long?
Yeah, it was really energizing. So I had been kind of thinking about doing a story on vaccine access around that time. In late spring and early summer, the sort of sense that I got was that in general, people kind of thought that like the U.S. was awash in vaccines, and if you weren't vaccinated, that was sort of on you. When in fact, a lot of communities faced a number of different kinds of barriers in getting access. And I was interested in exploring that question, and a statistic from a Kaiser Family Foundation poll popped out to me from that time, which found that Hispanic adults were more than twice as likely, or about twice as likely, to express a strong desire to get the vaccine, but they hadn't yet gotten it, than other groups. And so I started doing some digging to try to figure out why that might be the case, and ended up talking to a couple of medical professionals who are who sort of started this entity called Unidos contra COVID to try to get vaccine, to try to bring vaccines to people where they were in different Hispanic communities around Philadelphia. And I had talked to 2 people involved on the phone, and they were really great conversations. This small team was working sort of overtime on a volunteer basis for the most part, trying to get vaccines to these communities and setting up sort of pop-up events at different community events where they could meet people who often aren't sort of going out of their way to get medical care. A lot of people some people in these communities were undocumented, and so they sort of go from their home to work to a trusted place of worship, and that's sort of the only places that they really go. And this group was trying to bring vaccines to where those people were. And I was lucky enough to be able to go to one of these events and actually talk to the people who I had talked to the phone on, the doctors and nurses involved in running these events in person, and get sort of a better sense for who they were and why they were doing what they were doing. And also talking to the people who were at that event. It happened to be a sort of community soccer game where there was live music and taco stands and other food trucks. And just talking to them about why they hadn't gotten vaccinated and why they were getting vaccinated now. And it was really energizing to just hear from people in person. And I think it created a better story because I was able to get sort of a taste of what that event was actually like.
Yeah, that story kind of inspired me too, John, because it was like, it's never too late to get vaccinated. And one aspect that you didn't really touch on here is that a lot of people haven't gotten vaccinated because of misinformation. And that's been a big theme also throughout the pandemic, is just a lot of misinformation about the virus itself, about vaccines, about treatments. And so, that's kind of another big part of what we do as journalists, is trying to get people accurate information and counteract that misinformation without inadvertently spreading it, which is kind of a challenge.
Yeah, we actually got a great question on that from a listener who wanted to know, how does your awareness that you're speaking to almost 2 warring publics, the COVID vaccine deniers and the pro-vaccine encouragers, affect the content and tone of your reports? And we write for the general public. How do you write for the public when you know that people have vastly different points of view about this?
Yeah, some of that is kind of hard to counteract because it's a belief system as opposed to presenting people with facts and then having them decide rationally based on the facts. But as journalists, that's kind of what we do. And I recently wrote a story in a newsletter that was adapted into a story for our website about misinformation surrounding infertility from the vaccines. I got very frustrated because every time infertility would come up, other outlets would say things like, there's no evidence that the vaccine causes infertility. Well, while that's true, it's not nearly strong enough, because not only is there no evidence that it causes infertility, there's plenty of evidence that it does not cause infertility. And so I kind of went through a rundown of various studies that show that it does not cause infertility. It does not cause stillbirth. It doesn't harm you, but getting COVID actually does. I don't know if that changes anybody's minds, but it's what I can do to be part of a solution rather than part of the problem in spreading this information.
Thank you, Tina. Amy, I'd like to ask you a question. You mentioned earlier that you spent a lot of time this year looking at epidemics of the past as part of our Century of Science coverage for our centennial. And you really came to find that those experience that people had before really have lessons for us now. What do you think is important for people to know about that?
Yeah, so in working on this, for all of the advances that we've made in our understanding of pathogens and the immune system and in the development of vaccines, which is all truly amazing, what really struck me as I looked back at epidemics over the last century, going back to the 1918 influenza pandemic, is what hasn't changed. It hasn't changed nearly enough. Epidemics continue to disproportionately impact Black people, Latino people, Indigenous people, and others due to racial discrimination and long-standing health inequities. Epidemics can leave many children parentless, and evidence shows that without societal support, these children face devastating health and socioeconomic consequences. Epidemics leave communities grieving, and yet society as a whole is in a real rush to put epidemics behind us. In the end, epidemics, it's not just a story about science, it's a story about people and about suffering and about loss. And I think we need to do a much better job acknowledging that, acknowledging the grief that's out there, acknowledging the loss that people have experienced, understanding more about what does it mean to live through an epidemic? What does it mean to emerge from an epidemic? What do we need to do to support people and take care of the lingering, long-lasting physical and mental impacts? And it's also really, we are still, the public health cornerstones that we rely on with masking, with physical distancing, with, closing down large public venues, we started doing that a long, long time ago. These things work for us, and they're really important parts of our response.
Thank you, Amy. We've had a couple questions from listeners who want to know about what it's like to be living through a crisis at the same time reporting on it. And was it a challenge to step away from the anxieties you were facing personally to report on this issue? Who would like to answer that one?
I can start. Partly, it's really hard for me to disconnect from anything that's going on. I think in part just because even were I not a journalist, I would still be thinking about this extensively. Because of my background, a lot of the people that I interact with on a regular basis are in the virology world. So even when, I'm not at work thinking about viruses, the people that I talk to in my daily life, I'm also talking about viruses, or the immune system, or my mom is a school nurse, like I'm talking to her about what's happening in her school. So I don't often get a break, but then when I try to force myself to take a break or take a step back, I can't. Especially in my classes when I was in grad school, we would talk a lot about disease X. We've talked about we would learn about pandemics that had happened in the past, and what's the future one going to look like. And so the realization that this is, a disease X, there will be other ones in the future, it's a surreal experience, I think, to have gone through the training that I did and then be living through this and then reporting on it. Sometimes I feel like a little bit dissociated from everything, and I think part of that is probably a defense mechanism, so I don't go too far down a path or am trying to protect, my own mental health. Like kind of as Laura and Sujata alluded to, all of us are struggling. I don't know how long it's going to take for me to really kind of grieve once all of this is over. It's a one day at a time type thing.
Yeah, I hear you about that, Erin, about being always on, because when I'm not reporting on stuff actively and reading all these papers, and I'm hearing the news, and then I have family members and friends asking me, for information, and then for advice about what they should do in their daily lives. I mean, I have friends on Facebook who message me, and, one was asking me, should I get my kid vaccinated right away or should I wait for a while? And other ones have asked me, various questions. They asked me to vet things that they see on Facebook or in social media, which is good. I mean, I'm glad that they're looking to see whether or not what they're hearing is true, but I feel a tremendous sense of responsibility to make sure that people have good, accurate information. And it can be really hard when, I don't always know what to do in my own life. So, how can I possibly tell someone else what to do? It's very difficult. So yeah, it's it's been a hard row.
We all know too much.
And too little at the same time.
Right. I mean, and it also, intellectually, the more you learn about it, like it's, right, there's like interesting things about it. At the same time, you're also part of you're part of a pandemic where people are dying, people are sick. And you are trying to maintain a kind of, I don't know, you never know when it's going to hit you, how sad this whole thing is, right? You're trying to do your work and you're trying to put information together, and then something can just strike you about how devastating this has been.
Yeah, I would say for me, I love it when people ask me questions because that energizes me. Like when I'm talking to other people and people are asking me opinions about vaccines or, asking me, okay, this new variant has come, like, what do we know about how well vaccines work? I love being able to say our immune systems are really good at what they do. We can trust in our immune systems and we can, believe that things are going to be okay at the end of the day. But at the same time, then when I sit down and I have to write the story, I feel the weight of everything that I'm going to put on the page and that people are going to read that. And sometimes it's a little bit, I freeze because I don't know how to put what I just told somebody out loud into words on the page. It's a weird experience.
Yeah, and as the editor, my job is to make it possible for these wonderful journalists to do their jobs. And, when it's a story like this, which is such an important story, and the information that we're dealing with, depending on its accurate, could save lives, it could harm people. There is that huge weight. I wish I could say to all these wonderful people, it's okay, fine, go take a long vacation and enjoy yourself. But I know that it's exhausting as it is. They don't want to give up on this story, which is part of what makes them as good as what they are. But it's hard. It's hard. And on the other side of that, the flip side, we've also talked about what gives us hope. And I know Sujata talked about her explorations and finding meaning in life, both through new scientific research and also through her pottery, which I thought was a wonderful way to combine science and real life. What else gives you hope? John, what gives you hope in the midst of all this?
Something that has given me hope in my reporting, because we sort of talk to and often rely on a lot of the same sources, and you can kind of get a sense for how tired they're getting as their scientists trying to keep figuring this out, or public. So in my reporting, I've talked to a lot of local public health officials, whether that be like a city official who's trying to run public health programs, or school nurses trying to set up testing programs for their school. And talking with them, I always feel a bit more hopeful, knowing that there are these people who are really working against incredible challenges, and often amidst a public who either sort of questions or outright rejects what they're trying to do, and sort of the work that they're doing. And it's really hard on them, and yet a lot of the public health workers who I've spoken with over the course of this pandemic just continue to kind of do their best to build up a testing program for their school, or try to find new and creative ways of reaching people who haven't yet been vaccinated. And it gives me a little bit of hope to know that there are people out there like that who are still plugging away against incredible odds.
Yeah, it gives me hope to know that there are these amazing scientists out there who are, they're working on vaccines, they're working on treatments, they're working to better understand the virus and what it does to our bodies and how our immune systems react. And also just to see something we touched on in the session that Aaron and I had earlier with 4 COVID scientists about how collaborative people have gotten. I mean, there are these huge collaborations that have hundreds, if not thousands, of scientists from all over the world, putting their brain power to solve these problems. And it's amazing how much they have learned in such a short time. It seems like it's never enough, of course, but just the fact that they're on the job, that's very hopeful for me.
Yeah, I would say I kind of think of it as what I'm grateful for. I'm grateful for all of the doctors and medical practitioners who have been caring for people throughout this, also starting off with almost no information and very little they could do except provide the care that you provide for someone who is experiencing the symptoms, and I'm grateful, as John was saying, for all the public health officials that have been working so hard. And I'm grateful for vaccines, that we have something that can give our immune systems a preview of a pathogen, something that can protect us from the worst effects, is incredible. And it's not something that we have for everything. It's not something we've had in the past. It's amazing. And
to expand on that last point, Amy, that's also the thing that gives me hope, is that scientists developed the vaccine so quickly thanks to decades of research that had gone into all of this well before the pandemic even began. So, all of that work that they pulled on to make these vaccines within a year is just mind-boggling. And sometimes I sit down and I think about where we might be in the pandemic if we did not have vaccines, and it would be a very, very different place right now. There's obviously a lot of hurdles that we're still trying to overcome: vaccine inequity, vaccine hesitancy, just getting vaccines to people who want them but can't get them. Those are big things that we have to overcome. But the fact that we even have them in the first place, to be having those conversations, is incredible.
Yeah, I was going to add that too. It didn't have to work out this well. I'm just so incredibly grateful and shocked that it worked this well, that they're so incredibly effective. I had my little daughters get vaccinated last weekend, and it was just this moment of extreme gratitude. And more broadly, I think what gives me hope is this famous and cheesy Mr. Rogers line of look for the helpers here. And that includes those scientists, that includes all our healthcare workers, that includes all of our cafeteria workers who have been making meals for kids who need them. That includes you guys covering all of the science and giving people the information we need. So yeah, that's where I am.
And teachers, I I'll throw them in too. I mean, having to come back and in a really uncertain environment as the return to school happens.
Thank you all. Those are such heartfelt reflections. And I'm looking at one more comment here from a listener that says, since we're celebrating 100 years of Science News, I would be interested to see a retrospective of how Science News journalists 100 years ago covered the last page of the phase of the Spanish flu in 1921. And I say, that's a great question. And you can start by looking at Amy's wonderful story on our Century of Science page, which is looking at the big scientific advances of the past 100 years, and also includes highlights of our coverage. And you can also dig into our archives on our sciencenews.org website, which has more than 80,000 articles of original coverage, which you can see exactly what it looked like on the page back then. And this spring, we are going to also do a history of our reporting over the years, which includes some of the amazing things in science that we've covered, whether it's, the discovery of the DNA double helix, or insulin, or antibiotics, or the space race, but also some places where we went wrong and science went wrong too, in covering things that turned out to be dangerous or wrong or unethical. So I encourage you to stick with us and look forward. We've got a lot more coming as part of our celebration of our centennial. And I am hopeful and grateful because of our great journalists and many others around the country. We just had someone post a comment saying how wonderful it was that people were able to move from physical to virtual socialization and work. And Zoom concerts, work, school, play dates, all providing social interaction in new ways online. That's true. I think at the time it didn't seem like it was nearly the compensation for not being together, but I know that all that virtual communication last winter really helped me get through this, and I know it did for many others. So I would like to say thank you again to our amazing journalists and the work they do, and thank you to our great audience of Science News readers online and in print for supporting us. And anybody have a last comment you want to say before we sign off? All right, please stick with us and see what we do in our next 100 years of science coverage. Thank you all.